be able to do and with their trying to hold down costs without regard to the Medicare patient. Thank the gentleman for yielding to me.
Gentleman's time has expired. Gentleman from Pennsylvania.
Mr. Chairman, we're prepared to close. So, have you?
We will yield back the balance of our time.
Gentleman from California yields back the balance of his time. Gentleman from Pennsylvania.
Thank you, Mr. Chairman. Before I yield to the gentleman from Georgia, Dr. Gingrey, for our close, I just want to remind them of a statement by the chairman, Representative Stark, of the Ways and Means Subcommittee on Health during the debate and passage of PAPACA. He called the establishment of the board, quote, a dangerous provision that sets Medicare up for unsustainable cuts. We should be reminded of that. And at this time, I yield to one of the authors of the legislation, a distinguished member from the Health Subcommittee, and a Dr. Gingrey from Georgia.
And from Georgia is recognized.
Madam Chairman, as a physician member and co-author of the bill, I'm truly honored that Chairman Pitts is allowing me to close the debate on H.R. 5, the PATH Act. Appropriately named for meaningful medical liability reform and the elimination of IPAB, together will put Medicare in specific and health care in general back on the right path. A path to fiscal solvency for 1/6 of our economy. A path to compassionate, cost-effective, efficient, and timely health care for all who call this great country home. A path to fairness in our court systems so that those injured by malpractice get their day before a jury of their peers and they are justly compensated, not crowded out by the growing problem of frivolous claims and out-of-control legal fees. A path to a bipartisan and a bicameral solution to one of the most pressing issues that this nation will ever again face. That is to save Medicare for our current seniors and strengthen it for all future generations. Let's get started right now. Our country cannot wait any longer. Vote yes on H.R. 5, the Right Path Act. And I yield back the balance of my time.
Gentleman yields back. Gentleman from Pennsylvania.
Yield back the balance of my time.
Gentleman yields back the balance of his time. The gentleman from Michigan, Mr. Camp, is recognized.
Thank you, Madam Speaker. I yield myself such time as I may consume.
Gentleman is recognized.
Madam Speaker, today I come to the floor to speak in support of H.R. 5, the Protecting Access to Health Care Act, which, among other things, will repeal yet another poorly designed provision from the Democrats' health care law. Specifically, this legislation would repeal the Independent Payment Advisory Board, IPAB as it's commonly known, is a dangerous new government agency made up of unelected bureaucrats who can meet in total secrecy to decide what seniors will pay and what health care services will be available to seniors. This unaccountable board has but one objective: to save money by restricting access to health care for Medicare beneficiaries. Nearly 2 years since its passage, the Democrats' health care law remains deeply unpopular, with an Associated Press poll recently revealing that nearly half of the American people oppose the law. IPAB, which is a critical component of the law, illustrates why those concerns are still so strong. A separate poll confirms that opposition far outweighs support, with 73% expressed concern that a Medicare cuts recommended by IPAB could go into effect without congressional approval, even if IPAB's recommendations overturn a law previously passed by Congress. 71% expressed concern that changes made to Medicare based on IPAB's recommendations cannot be challenged in court, and 67% worry that IPAB could choose to limit which specific health services are covered by Medicare. The American people have every reason to be worried. We should be protecting and empowering our seniors, not jeopardizing their access to health care. Yet IPAB removes seniors, physicians, and families from the decision-making process about how best to meet their health care needs. Instead of giving seniors more choices, these unelected bureaucrats will take away choices from patients, from doctors, and from families. This government-knows-best approach is why Americans across the country support repeal, and it's also why there's strong bipartisan support here in Congress to repeal IPAB. When the Ways and Means Committee considered this legislation, we received numerous letters from groups across the nation representing employers, patients, doctors, and healthcare professionals who voiced strong support for IPAB repeal. The groups span across the political spectrum and include Easter Seals, the Alliance of Specialty Medicine, the Veterans Health Council, Freedom Works, and Americans for Tax Reform. In total, over 390 groups have signed letters asking that Congress repeal IPAB, and I ask unanimous consent that these letters be submitted into the record. America's seniors deserve better. Without reform, the Medicare trustees have said that Medicare will soon go broke and not be able to provide the benefits seniors rely on. With more and more Americans becoming eligible for Medicare each day, no time is more urgent than now to secure the future of beneficiaries' access to care. IPAB does just the opposite. It threatens seniors' access to health care, and that's why it must be repealed. And, Madam Speaker, the Democrats got it right when they named the IPAB. It truly is the Independent Payment Advisory Board. It's independent from seniors, independent from people with disabilities, independent from the voters, and independent from legal challenges and appeals, and independent from any accountability. It's time to give that independence back to doctors, to patients, and to Congress by voting to repeal this Washington power grab. I urge my colleagues to join me in supporting repeal of the Independent Payment Advisory Board and to vote yes on this legislation.
The gentleman's request to insert documents into the record will be covered by general leave. The gentleman from Michigan, Mr. Levin.
I yield myself such time as I shall consume.
Gentleman's recognized.
I hope everybody's been listening to this. What has become clear is this. The Republicans have a three-act play. First, repeal IPAB. Next, repeal the rest of health care reform. And finally, repeal Medicare. It is so hypocritical to come forth and say that the efforts of Republicans is to protect Medicare when the purpose of it is to destroy it. That's what would happen if they had prevailed before. That's what would happen if they prevailed today with their voucher plan. And so the third act really came forth before the first act. So they rolled out yesterday their budget plan that essentially would repeal Medicare, would destroy it. There would be a voucher, and over time, the end of Medicare. It's an essential commitment to the seniors of this country. And we Democrats are determined to thwart every effort to destroy it. Now as to the first act, repeal IPAB. You know, it's interesting that Medicare is a major instrumentality for assuring that over time the costs of Medicare are brought under control, protecting the health care opportunities of seniors. Indeed, there have been efforts already under the Accountable Care Act to bring under control the costs of Medicare to make sure it survives. So, being an essential part of controlling health care costs over the long term, the Republican proposal essentially would go in the opposite direction. And that's why the CBO last year projected, and I want everybody to listen to this, that health care costs would jump by 39% under the Republican plan to end the Medicare guarantee. And that's why 300 economists have said that health reform puts into place essentially every cost containment provision policy that analysts have considered. And it's because of those policies that CBO has given this estimate that IPAB isn't going to be triggered until sometime after 2022. So what happens is the Republicans come forth with a repeal of IPAB as a first step towards repealing Medicare when they have never presented an alternative in terms of the Accountable Care Act. So today we hear all the scare tactics about a board whose operation effectively won't be triggered for a decade. That's a scare tactic that is not worthy of this floor. And so I urge very much that we oppose. You know, it's interesting that the Republican budget has a cap that is more severe, if you want to put it that way, more strenuous than the provision that relates to IPAB. And so they come forth and they say that IPAB, which won't be triggered until 2022, is something that they should oppose. Well, they want to put in place a budget this year that would have a more severe cap than is in IPAB. And let me also say the notion that there is some agency here that could act without any role for Congress is simply untrue. It's not true. You shouldn't say it. We have an opportunity once IPAB goes into operation to review any recommendation that comes forth and to replace it as long as the various targets are met. So I urge very much that we reject this proposal, in part because the repeal in and of itself I think is a mistake, but mainly because what the aim is here, and that's been so clear from the debate, because people who come here on the Republican side, some of them talk about IPAB, some don't even discuss IPAB. They talk about the Accountable Care Act. And the polling data we have is essentially relating to the Accountable Care Act as well as to IPAB. And I think the more people understand what has been going on, the more they see the benefits of health care reform, the more they will be supportive of it. And we're going to take that case to the American people. Let me just give you a few numbers that everyone should know about ACA. It's been only 2 years since it was signed into law, but Americans are already receiving the benefits of lower costs and better coverage. Let me give you a few facts. 86 million Americans have received one or more free preventive services, such as checkups and cancer screenings. 105 million Americans no longer have a lifetime limit on their coverage. 105 million Americans. And up to 17 million children with pre-existing conditions can no longer be denied coverage by insurers. Up to 17 million kids. You repeal this act, you put them into total jeopardy. 2.5 million additional adults, young adults, up to 26, now have health insurance through their parents' plan. 2.5 million. You repeal, if you had succeeded in past efforts of repealing health care reform, those 2.5 million people would have been out in the cold. 5.1 million seniors in the donut hole have saved $3.2 billion on their prescription drugs, an average of $635 per senior. If you had succeeded with repeal, over 5 million seniors would have been essentially with increased costs. And over 2 million seniors have had a free annual wellness visit under Medicare. Already, under the small business health care tax credit, over 350,000 small employers have used it to help provide health insurance for 2 million workers. And Republicans come here using scare tactics about IPAB, 10 years away from being triggered, according to CBO. And you essentially say, repeal health care reform, though you've never had a comprehensive plan to replace it. That's been the bankruptcy of your position. The bankruptcy of your position. And you come forth, I finish, reminding everybody that we're the only industrial nation on the globe which has tens of millions of people who go to bed every day without a stitch of health insurance coverage. And the administration's brief before the Supreme Court has illustrated what the result is in terms of the added costs of the uninsured who go to emergency rooms. Billions and billions of dollars that are essentially shifted to people who have insurance and shifted to taxpayers who have to cover the cost of emergency coverage. So we come here with a passion. We worked hard to support and to pass this act. We worked hard to put it together. A major piece of legislation like that always needs continued work, but not its repeal. That would be a grave, grave, grave mistake. So I think it's time to pull down the curtain on this three-act play of the House Republicans, trying first to repeal IPAB, then to repeal the rest of health care reform, and then to repeal Medicare. Fortunately, if we're mistaken and the majority passes it here, it will deserve a death in the Senate of the United States. I reserve the balance of our time.
Gentleman reserves the balance of his time. Gentleman from Michigan.
Well, thank you, Madam Speaker. I yield myself 15 seconds just to say that our Republican alternative, our Republican health care bill, prevented unlawful rescissions, had no lifetime caps on coverage, did not deny coverage to those with pre-existing conditions, and was the only bill that was scored by CBO as lowering premiums. Also, we did it without spending $2 trillion and 2,400 pages and did not create a board of 15 unelected bureaucrats. And with that, I would yield 2 minutes to the distinguished chairman of the Health Subcommittee, the gentleman from California, Mr. Herger.
Gentleman from California is recognized for 2 minutes.
Thank you, Madam Chairman. I rise in strong support of H.R. 5. Today's debate goes to the heart of the question of what kind of health care system we want to have. House Republicans believe the solution to making health care more affordable and strengthening the Medicare program is more freedom, empowering innovation and competition to reduce costs and improve quality, giving seniors the opportunity to choose the health care that's best for them. The Independent Payment Advisory Board, IPAB, represents a very different approach to controlling health care costs, a one-size-fits-all plan in which unelected and unaccountable bureaucrats decide what kind of health care you should get. Physicians, patient advocates, and respected scholars, Democrats and Republicans alike, have warned that the IPAB threatens access to care for seniors and people with disabilities. The board has the authority to meet and make decisions in secret without considering the perspective of patients and their doctors and without judicial review. Madam Chairman, this is the wrong approach, and IPAB must be repealed. H.R. 5 also includes important reforms to reduce the cost of frivolous medical lawsuits. The President's health care overhaul has not fulfilled his promise to reduce health insurance premiums by $2,500, but common-sense medical liability reforms will truly bring down health costs both for American families and the Medicare program. I urge passage of this legislation.
Gentleman from Michigan, Mr. Levin, is recognized.
Thank you. I now yield 3 minutes to the distinguished member of our committee, Mr. Blumenauer from the proud state of Oregon.
Gentleman from Oregon is recognized.
Thank you very much. I come to the floor coming from the Budget Committee, where my Republican colleagues are busy at work breaking the commitment that we all made to one another, establishing a path forward on deficit reduction. It wasn't just a commitment that was made amongst legislative leaders. We wrote it into law, and now they're breaking that commitment. They are involved with budgets that are going to actually reduce health care in this country, and they would come to the floor and ask us to get exercised about something that may happen 10 years from now. I find the language curious. You could just as easily say, instead of the Supreme Court, you could talk about 9 unelected judicial hacks meeting in secret that have no judicial review. They're a power unto themselves. Get a grip. IPAB comes into play only if we are unable to deal with controlling costs. Remember, the Republican friends, I voted against it, set up the SGR, that we have to have a doc fix every year, putting cost control on automatic pilot because they didn't have the gumption year after year to deal with the policy changes to make a difference. We have for Medicare, MedPAC, that gives us recommendations, but Congress blinks. Well, what's going to happen, maybe 10 years from now, if costs are not under control, then there will be 15 people who are experts, who are recommended by congressional leaders, nominated by the President, confirmed by the Senate, who will make recommendations if Congress doesn't do its job. And then Congress will be able to take those recommendations and put in place alternatives. Nothing is going to happen here without Congress having an ability to match and do better. But because Congress historically hasn't had a backbone and has failed miserably in areas of cost control and reform. We put into the Health Care Reform Act a fail-safe, not unlike what we've had to do to take base closing out of the hands of the log rolling in Congress and have a streamlined procedure. This is a fail-safe. This makes sense. It's not going to happen unless Congress fails in its task. I strongly suggest that what we ought to do, rather than trying to unravel health care reform on this floor and in the Budget Committee, let's accelerate it. Remember, the elements in the health care reform, when you unwind them, virtually without exception, have their roots in a bipartisan consensus of what needs to happen to make our health care system more efficient. Many of these pilot projects, these demonstrations, have actually already been at work in states across the country, including some that have Republican governors. We're doing some of it in the state of Oregon. It has the dreaded mandate, which was a Republican think tank option that was an alternative to Hillary Care 20 years ago, and in fact was put in place by Governor Romney, who's going to be, by all accounts, the Republican standard bearer. This is an example of Congress at its worst. Making up a problem, dealing with something that would help us do our job better, trying to demonize it in a way that you could do with virtually any other board or commission, ignoring the safeguards, ignoring the fact that the statute says specifically that it shall not ration, and instead they're going to allow insurance companies to ration and ignore the need for reform. I strongly urge rejection of this misguided proposal. Let's get back to work. Let's do our job. It will never come in play if Congress does its job, and Congress will always have the last say. Thank you, and I yield back.
Gentleman from Michigan, Mr. Camp, is recognized.
Well, thank you. Thank you, Madam Chairman. I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentlewoman from Kansas, Ms. Jenkins.
Gentlewoman from Kansas is recognized for 2 minutes.
Thank you, Madam Chair, and I thank the Chairman for yielding. The President's health care law is chock full of pitfalls, tax increases, government overreaches, and newly created bureaucracies. But perhaps the most outrageous and dangerous manifestation is the Independent Payment Advisory Board. This board of 15 arbitrarily appointed bureaucrats is charged with slashing Medicare reimbursement rates, which will drastically impact the medicine and procedures available to our seniors. The IPAB has no mandate to improve patient care. Its mandate is to meet a budget, and it may ultimately lead to the rationing of care for our senior citizens. The IPAB gives these bureaucrats unprecedented power with no accountability, no judicial review, and no requirement for transparency. The simple fact is that the American people don't want and certainly don't need bureaucrats coming between us and our doctors. So today we ask for repeal of the IPAB, but we will also make up for any amount of lost savings this absurd board would have been able to find by strengthening our health care system with honest and straightforward medical liability reform. Frivolous lawsuits have caused malpractice insurance rates to skyrocket. As a result of the price of health care for patients has followed the same trajectory, and we've seen dramatic health care access issues for our rural communities. Together, repealing the IPAB and enacting these common-sense medical liability reforms, this legislation will reduce the deficit by over $45 billion, according to the CBO. These are common-sense, bipartisan, fiscally responsible reforms that strengthen the doctor-patient relationship and put the American people back in charge of their health care decisions. I urge all of my colleagues to support this. I yield back.
Gentleman from Michigan, Mr. Lemon.
I now yield 4 minutes to another member of our committee, the Ways and Means Committee, the gentleman from Wisconsin.
Gentleman from Wisconsin is recognized for 2 minutes.
Thank you, Madam Chair. And I thank the gentleman from Michigan for yielding me this time. And Madam Chair, I rise in opposition to H.R. 5. 2 years ago, the Affordable Care Act was passed, and I was a proud supporter of that legislation, not because I thought it was the perfect bill, because I thought it gave us the tools and the potential to reform a health care system that was in desperate need of reform, of putting things in place that could deliver better quality of care that's given for a better price, and also increasing the access of health insurance throughout the country to finally address the 52 million uninsured Americans that we have living in our own communities. Yet the ultimate verdict on whether health care reform works or fails for everyone in this country is whether we can figure out creative ways of bringing down those costs in health care. One thing I do know under the health care reform bill that has been enacted, that in my congressional district in western Wisconsin, this year alone, 4,200 young adults are able to stay on their parents' health care plan, whereas before they couldn't. What a relief that has been to those families, making sure that those kids, many of whom are in school, can stay on the family plan. 5,800 seniors this year who have fallen into the donut hole are seeing a cost savings of roughly $610 apiece because of the 50% price discount that they now get under this legislation. That's not peanuts in western Wisconsin. 86,000 seniors now are able to go in and get preventive care services without co-pays, without deductibles, without out-of-pocket expenses. We want them to go in and get those tests so something worse doesn't happen to them, which will inevitably drive up the cost for everyone in the Medicare system. And 15,000 small businesses in western Wisconsin now qualify for tax credits for providing health care to their employees to make it more economically feasible for them to do what they want to do, and that's provide health care coverage for their workers. That 35% tax credit goes up to 50% in 2014 when we're able to move forward on the creation of the health insurance exchanges. And 39,000 children in western Wisconsin who have a pre-existing condition can no longer be denied health care coverage in their lives. This is the right thing to do. And yet we have to figure out some cost containment measures to make sure that it's sustainable and it's affordable in the future. The Independent Payment Advisory Board is a backstop in that effort. It's not the first thing we go to in order to find cost savings, but if costs do exceed target growth rates, the Independent Payment Board is able to come forward with Congress with recommended cost savings that will be implemented only if Congress refuses to act ourselves. And that's been the problem around here for too long. We get recommendations from MedPAC and other entities of where we can find cost savings, but because of the inability of Congress to stand up to some powerful special interests, quite frankly, it's very difficult for this institution to act by itself in order to implement those cost savings. I find it a little bit humorous that my colleagues on the other side are so fearful of this Payment Advisory Board making some decisions when it comes to the rising health care costs when they feel perfectly comfortable turning these decisions over to private insurance companies who are motivated by profit and trying to maximize their margin of gain by providing health care coverage. I think that's nonsensical. But ultimately, if health care reform is going to work, we have to change the way health care is delivered in this country so it is more economical and how we pay for it. So it's value and not volume-based anymore. I come from an area of the country with health care providers that have models of care that are highly integrated, they're very coordinated, they're patient-focused, and they're producing some of the best results in the nation. Yet a Medicare recipient in LaCrosse, Wisconsin receives on average about $5,000 a year compared to $17,000 in Miami. Yet the results in LaCrosse is much better than the results in Miami, because there are studies out there showing that there's overutilization in the delivery of health care, which is driving up costs for everyone. If you believe the studies that are out there, and there are many, it shows that close to 1 out of every 3 health care dollars that we are spending in the system goes to tests. And may I have 1 additional minute?
I yield 2 additional minutes to the gentleman.
I thank the gentleman.
The gentleman is recognized for an additional minute.
The studies show that 1 out of every 3 health care dollars are going to tests, they're going to procedures, they're going to things that don't work. They're not improving health care. And oftentimes, because of the overutilization that patients are receiving, many of these patients are being left worse off rather than better off. So we've got to reform the delivery system, which the Affordable Care Act puts in place. But ultimately, we have to change the way we pay for health care. We need to end and destroy the fee-for-service system, which is all volume-based payments, and move to a value-based reimbursement system. The IPAB Commission can help us get to that promised land. And this has been a bipartisan issue for a long time. Dr. Frist has been talking about payment reform that's value-based for as long as I can remember. My own former governor, the former HHS Secretary Tommy Thompson, has said repeatedly, if we do anything, make sure that we change the payment system so it is value and not volume-based anymore. Mark McClellan, President Bush's CMS director, same thing. So there's been bipartisan recognition that we have to do it. IPAB gives us an opportunity to do that. But it's not the final say. They merely come forward with their recommended cost savings and challenges the Congress to come up with an alternative cost savings. So, folks, this is gut check time. This is whether we are serious about trying to bend the cost curve. Their plan would get rid of Medicare, turns it into a private voucher, and a voucher that's inadequate to address the costs that seniors face. They don't reform the way health care is delivered. They're not reforming how we pay for health care. They're merely changing who pays for health care under Medicare. And those costs are going to be shifted on the backs of our seniors. That's no way of reforming a health care system that's in need of reform. That only addresses the Medicare portion within our budget. What we need to be working on, and what the Affordable Care Act gives us the tools to do, is to reform the entire health care system, both public programs and private programs. And that's something that we fundamentally have to do to get our economy back on track, creating good-paying jobs. Because if you just repeal it now, we go back to the status quo, which means more uninsured, higher costs, and our businesses less able to compete globally. I encourage my colleagues to reject H.R. 5. I yield back.
I yield myself 15 seconds, and I would just say that with regard to IPAB, the 15 unelected people appointed by the President, Congress can't simply reject the IPAB findings. Congress has to reject and find those savings somewhere else within the program, unlike the Base Closing Commission, which some members have cited. And these are all people appointed by the President. So with that, I would yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Minnesota, Mr. Paulson.
Is recognized.
Thank the gentleman for yielding. And Madam Speaker, the very foundation of our health care system is that relationship between a patient and their doctor. But the President's new health care law now inserts government bureaucracy in the middle of that long-standing relationship. And one clear example of this is the establishment of the Independent Payment Advisory Board. This 15-member board of unelected, unaccountable bureaucrats who will soon have the authority now to dictate our nation's Medicare policy by effectively deciding what health care seniors can receive. And since its inception, IPAB has been the focus of vocal and sustained opposition from doctors, physicians, and patients because it does threaten to reduce beneficiaries' access to treatments and services that are included in the Medicare program. Madam Speaker, repeal of IPAB has strong bipartisan support. Given the widespread concern about the impact that IPAB will have to deny quality health care services, it's no wonder that about 350 organizations that represent veterans, seniors, employers, small and large, as well as doctors and physicians and consumers in all 50 states support its repeal. Although a majority now in Congress of us know our concerns about IPEAL and support its repeal of IPAB, it is the American public, including many folks from my community, who remain the most vocal about ending this program before it's implemented. And the American people have every reason to be worried about this IPAB board. The unchecked powers of IPAB have been explained by my colleagues already at length. And simply put, IPAB is a dangerous government agency that will be made up of unelected bureaucrats with no oversight, no accountability, no recourse for seniors to appeal any of IPAB's decisions. The decision-making, the deliberations, the meetings that IPAB have do not have to be held in public. Madam Speaker, rather than endangering Medicare beneficiaries, we should be empowering them. Rather than making decisions behind closed doors, we should be having these discussions in public, in our hearing rooms, between doctors and patients and consumers. Let's do the right thing and protect American seniors by repealing this provision, this overreaching provision. I yield back.
Gentleman from Michigan, Mr. Levin, is recognized.
I now yield 4 minutes to the gentleman from Texas, a member of our committee.
Texas is recognized for 4 minutes.
I thank the gentleman.
Megan?
Many an American family has been wrecked by soaring health care costs. We know it's been a leading cause of personal bankruptcy. We know that spiraling health care costs have been a leading cause of credit card debt. And now Republicans have continued their sustained effort to wreck the Affordable Care Act. As with the Republican effort, we have been witnessing at the same time that this debate is going on within the Budget Committee, on which I also serve, the Republican plan to end the guaranteed benefits of Medicare. They think that our seniors pay too little, and so they offer a voucher plan that will result in our seniors having to pay much more for their health care. They tell the senior to go out, and the person with the individual with disabilities, they say go out and fish for insurance with this voucher, but they won't find any fish biting, though they will continue to be bitten with rising health care costs. That's why President Lyndon Johnson created Medicare in the first place, because private insurance companies weren't interested in covering the old and the infirm. Well, today's approach is the same approach that Republicans took last year when they had their signature accomplishment. Right in the first month of their takeover of this Congress, they came out here with this page-and-a-half bill that I call the 12 platitudes. They repealed what they said they didn't like, and they came forward with 12 lines of what they said they would replace the Affordable Health Care Act with. But all we've gotten since then are bills that began after they did the total repeal with repealing individual sections, like school health care clinics, like this proposal dealing with the question of health care cost. We know they don't like it. We know they don't like President Obama and anything that he's for. They tell us everything that is wrong with the Affordable Health Care Act, but they sure can't come up with a better idea that they have the courage to bring to a vote in the Ways and Means Committee or bring to a vote on the floor of this House. It's all about what they're against, but they've not brought any of the 12 platitudes that they approved last year into legislative form to deal with this issue of spiraling cost for our government and families, or to deal with any other aspect of the Affordable Care Act. Now, I have to say, quite frankly, I wish the Affordable Care Act were as good as they think it is bad. It's not. It is a compromise of a compromise. It has many inadequacies, but compared to the Republican alternative of doing nothing, and compared to the broken health care system that wrecks so many American families who are faced with a health care crisis, this approach is far superior. Now, the bill's opponents, or the bill today that opposed this board, they tell us that, you know, Congress should be able to make all these decisions. Well, I've served on the Ways and Means Committee and on the Health Subcommittee previously for a number of years. I wish it could be so, and I think we could play a more constructive role. But frankly, the history is that Congress hasn't done a very good job of controlling cost, and when we have taken steps to control cost, as we did with the $500 billion in cost control that we put into the Affordable Care Act, that increases the solvency, extends the solvency of the Medicare Trust Fund by 12 years, all we've gotten is attack and criticism from them for the steps that we took that did limit cost. So I don't view this aspect of the Affordable Health Care Act as necessarily the best way to do it or the only way to do it, but when all they offer us is nothing except vouchering Medicare for our seniors and similar, I think we should stick with the reform that we have until a better alternative is presented, and that alternative is not being presented tonight. Republicans don't have a plan to make the hard decisions to lower health care costs. They just want our seniors and individuals with disabilities and families across America to pay more so that they can preserve all of these tax breaks for the wealthiest and most successful economically people in our society, and for all those corporations that export jobs abroad to continue to provide them incentives to do just that. I believe that this bill should be rejected, just like their other repeal efforts, until they come up and present on the floor a better idea, and I don't think they have one. They just have all the retreads of the Bush years, the Bush-Cheney years. Until then, I say stick with the Affordable Care Act. I yield back.
Gentleman from Michigan is recognized.
Thank you. I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Illinois, Mr. ROSKAM.
Gentleman from Illinois is recognized for 2 minutes.
Thank you, Madam Chairman. Mr. Chairman, thank you for yielding. Madam Chairman, did you notice something The gentleman from Oregon, and I took a note and I'm kind of paraphrasing, but he basically was arguing from the other side of the aisle that IPAB, this cost control board, will basically never come into play as long as Congress does its job. During the health care hearing that we had in the Ways and Means Committee, the gentleman from Wisconsin on the other side of the aisle characterized as IPAB as a leap of faith. And now we just heard from the gentleman from Texas who acknowledged it's not the best solution, but let's stick with it. Well, here's the problem with sticking with this failed solution, Madam Chairman. They're asking seniors to bear the brunt of this. We had a witness, an expert witness, Madam Chairman, who came into the Ways and Means Committee, and I posed this question to him. I said, there's no rationing per se. It's defined out of the bill, although it's not defined in the bill. But the bill says there can't be rationing. But can there be per se rationing? In other words, if cost is denied based on, or if coverage is denied based on cost, is that rationing? And he said, absolutely, Congressman. So think about what the other side of the aisle is asking. Take a leap of faith, a leap of blind faith, that somehow Congress is going to come up with the remedy and that seniors are not going to be held at risk. The gentleman from Texas said that we're only here criticizing things. Let me tell him, Madam Chairman, what we are for. We're for the repeal of IPAB. We're for the repeal of something that is going to put such downward pressure on seniors it will make people's heads spin. What we've got to do is make sure that we put remedies in place that empower seniors, that create patient-centered health care, and don't deny care and put more out-of-pocket costs on the backs of seniors. We can't repeal this thing fast enough. We need to vote aye and get this done. I yield back.
Thank you. Gentleman from Michigan, Mr. Levin's recognized.
Look, you know, it's curious. You're talking about, according to CBO, a board whose operation would be triggered in 2022. You come here and scare people. It doesn't work. You talk about rationing. You're talking about an operation 10 years from now. Right now, health care is being rationed. You have 50-plus million people who have no insurance. 50-plus million people who have no insurance at all, and you haven't come up with a bill that would address that. I now yield, who's next? I now yield 4 minutes to the gentleman from New Jersey, who has been, Mr. Andrews, who has been so key as you come to the podium, who's been so key in the health care debates, and I'm proud to yield 4 minutes to you.
I ask unanimous consent to revise and extend my remarks.
Objection.
I thank my friend for yielding and for his compliment. When our mothers and fathers go to the doctor or the hospital, we want to be sure they get the best health care that can possibly be delivered that their doctor and their family think they ought to get. And that health care should never be subject to the strategic plan of any insurance company or the whims of the marketplace. Because it is not profitable, as a general rule, to take care of the aged and the infirm, President Johnson and this Congress in 1965 created the Medicare guarantee. And they guaranteed that our seniors and people with disability would get the care they need, irrespective of the whims of the marketplace. The majority brings this bill to the floor today because they raise fears about what might happen to the Medicare guarantee 10 years from now. There is a very important question about Medicare before this Congress, but it's coming about 8 days from now, not 10 years from now, when the majority will bring yet another budget that systematically unravels and ends the Medicare guarantee. Call it what they will, when you have a system where the healthiest and the most prosperous, in some cases the youngest retirees, can opt into a private insurance system, those that will be left in regular Medicare will be the aged and the infirm and the poor. And Medicare will then go the way of Medicaid, which their budget cuts by nearly 40%, according to some estimates. And so, frankly, as a diversion from the real threat to Medicare, which is yet another Republican budget coming to this floor 8 days from now that will end the Medicare guarantee. We now have a series of wild accusations about the Independent Payment Advisory Board, which the Congressional Budget Office says, based upon current cost performance, would have no role for at least 10 years. So we hear all these things about these unelected bureaucrats making decisions. I would say, Madam Chair and fellow House members, consider the source. 2 years ago, we heard that everyone in America would be in a government-run health plan if the Affordable Care Act passed. It hasn't happened. 2 years ago, we heard that every small business in America would be forced to buy unaffordable health insurance for their employees. It hasn't happened. 2 years ago, we heard that every American family would have to bear a crushing tax increase because of the Affordable Care Act. It hasn't happened. 2 years ago, we heard there would be drastic cuts in benefits to Medicare beneficiaries because of the Affordable Care Act. Not only has it not happened, benefits have increased. Seniors pay a lower share of their prescription drug costs, and Medicare pays more. Seniors have access to annual preventive checkups without copays and deductibles. It hasn't happened. And then finally, lest we forget, those who say that the IPAB is such a virulent threat to Medicare said there were death panels in the Affordable Care Act. Where are they? Can anyone on the other side point to one person who has gone before a government committee and been denied health care since the Affordable Care Act as a result of that act? It's a fiction. It's a distortion. I'd ask...
Gentleman, you have 2 minutes.
I thank the gentlelady. It is a fiction. It is a distortion. And here we are at it again. Now, in the first 2 weeks of their majority, the majority came here and made a promise to the American people. They said, yes, we're going to try to repeal the Affordable Care Act, but then we're going to replace the Affordable Care Act. It was repeal and replace. Well, we've had the repeal as a recurring scenario on the floor. This is just another chapter in it. Where's the replace? For the provision that says that people 26 and under can stay on their parents' plan, if you repeal the Affordable Care Act, where is your bill to replace it? For the provision that says that no person can be denied health insurance or charged more for it if they're diabetic or if they have breast cancer or asthma, where is their replacement? For the provision that says that seniors who fall into the donut hole get significantly greater help in paying for their prescription drugs, where is their replacement? For the provision that says that small business people who voluntarily provide health insurance to their employees get a significant tax cut, where is their replacement? There's a saying that our friend from Texas says about being all hat and no horse. The majority is all repeal and no replace. So this is yet another example of a debate that's tired, worn out, and seen its day. The Affordable Care Act is helping improve the lives of Americans. An empty political debate like this one isn't, and certainly ending the Medicare guarantee, as the Republicans will try to do in 8 days, is the wrong way to go. So is this bill. I yield back.
Gentleman yields back. Gentleman from Michigan.
I yield myself 30 seconds. I would just say to my friend from New Jersey who says consider the source, and the source is the American people. 73% have expressed concern that the Medicare cuts recommended by IPAB would not only go into effect without congressional approval, but would also hurt their ability to get the Medicare services they need. And let me just say, I hear from my friends on the other side how important this is, IPAB, to the integrity of Medicare. It is not effective until 2022. And let me just say, with regard to the Medicare cuts that are in your health care bill, most of them don't take place until 2014. And I would just say that our health care bill included provisions that covered pre-existing conditions, included many of the provisions the gentleman mentioned.
Will the gentleman yield?
And we did it. I will not yield. It's my time. And we did it without a tax increase, and we did it as the only health care bill that was scored by the Congressional Budget Office as decreasing premiums for American citizens. And with that, I would yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentlewoman from Tennessee. Ms.
Gentleman
Black.
from Tennessee is recognized for 2 minutes.
Thank you, Madam Chairman. Let's first of all start with a simple fact that no one in this room can deny, and that is there are 10,000 baby boomers that are added to the rolls each day. Medicare's exponential growth will cause the program to go bankrupt in 10 years. The Congressional Budget Office and the Medicare and Medicaid trustees have been ringing these alarm bells about Medicare's dwindling finances, and we must act now. Over 46 million Americans rely on Medicare for their health care, and something must be done soon to save this program for the future generations. Unfortunately, the President's budget proposal failed to address Medicare's grim future. Instead, what we have in the law books now is a 15-member board that is charged with cutting costs and denying care to our seniors. The Independent Payment Advisory Board, established in the health care law, would cut physician payment rates, forcing many doctors to stop seeing Medicare patients. This board makes senior care harder to access and puts bureaucrats between the patients and their doctors. Now, it's been said here today, there's not another plan. Let me correct that. There is another way. As a matter of fact, there is a bipartisan way. The plan for Medicare that is a bipartisan proposal does 3 things. It does not make any changes for those at or near retirement. It offers guaranteed coverage options to seniors regardless of their pre-existing conditions or health history, and it's financed by a premium support payment that's adjusted, provided additional financial assistance for those that are low income or less healthy seniors, and more wealthy seniors will pay. So the choice is clear. We can continue to stick our heads in the sand and go on with a program that takes away choice for our seniors and limits their care and support the status quo, or we can approve a plan to save Medicare and provide more choice. For me, the choice is clear. Thank you, and I yield back my time.
The gentlelady yields back. Gentleman from Michigan, Mr. Levin.
Let me just say, it's strange to say you save something by destroying it. It's 1984 and 2012. I now yield 2 minutes to the gentleman from New Jersey.
I ask unanimous consent to revise and extend my remarks.
Without objection.
Thank you, Madam Chair. I thank my friend from Michigan for yielding, and I want to comment on something, Madam Chair, that my dear friend from Michigan, the chair of the Ways and Means Committee, said. As has become part of the Republican catechism, he talked about the so-called Medicare cuts that were in the Affordable Care Act. It is correct that in the Affordable Care Act, we reduced Medicare spending by $495 billion by cutting corporate welfare to insurance companies, by cutting overpayments to medical equipment suppliers, and cracking down on fraud and abuse of the Medicare program. The majority must agree with these ideas because in the budget they are marking up today in the Budget Committee, every penny of those $495 billion in savings is included in the majority's budget. The majority must agree with these savings, and I commend them for it, because the budget resolution that passed here last year, that essentially every member of the majority voted for, included every penny of those $495 billion in savings. So I would ask my friends on the other side that if they're so in objection to those cuts, why did you vote for them last year, and why are they in your budget this year?
Since the gentleman's asking,
I would be happy to yield to my friend.
We are using those dollars to protect the Medicare program. You use those dollars to create a new entitlement,
Reclaiming my time. Reclaiming my time.
I'm
reclaiming my time.
Reclaim your time.
Reclaiming my time. Because the gentleman's point was there was something wrong with the cuts. Obviously, he would contradict that point. Every dollar of the cuts in the Affordable Care Act have been embraced, supported, and voted for by the Republican majority, for which you deserve credit.
Gentleman from Michigan, Mr. Camp.
I yield 2 minutes to a distinguished member from Mississippi, Mr. Nunnally.
Gentleman is recognized.
Thank you, Madam Speaker. I want to thank the chairman for his leadership in this area. Thank you for yielding. I find it fascinating as I listen to debate that even while discussions going on the budget, that we're hearing accusations that say Republicans want to end Medicare. In reality, 2 years ago when the National Health Care Bill passed, that ended Medicare as we know it. That cut $500 billion out of Medicare spending. That put in place this unelected group of bureaucrats that will make health care decisions for seniors. And I hear this afternoon suggestions that say, well, it may not even go in effect for 10 years. Let's wait and see. Well, we have a saying in Mississippi. Do you know when the best time to kill a snake? That's the first time you see it. This IPAB is a snake, and the best time to kill it is today. The club and the vehicle by which we'll kill it is this bill, and that's why I'm going to vote for it, and I urge all of my colleagues to do the same.
Yields back. Gentleman, Mr. Levin from Michigan is recognized.
It's now my privilege to yield 3 minutes to the distinguished gentleman, Mr. Clark.